Hi guys, it's Nate Coomer, physical therapist and host of Daily Dose PD. We're back talking again in this next video series about flexibility. So being able to get the same range of motion that we've always had out of our body becomes difficult with Parkinson's, whether it's standing with a stoop posture or feeling like we can't swing our arms like we used to when I walk, or reaching around behind us to grab maybe the seat belt when we get in the car. Those things can become more difficult over time, and we want to work on stretches in our exercise program to fight those things. So we're going to go through a few of them in this next video series. The first one we're talking about today is hip flexor flexibility. So this muscle is very often tight in Parkinson's disease, and there's a very simple exercise we can do to stretch it using a chair and a pillow. So if you have those two things at home, you can go ahead and get those, and I'll see you back here. When you're ready, you're going to place the chair in front of you. We'll put the pillow right below us. If we have knee problems, that'll help soften the weight on our knee. And what I'm going to have you do is place your hands on the chair, place one foot forward, and one knee down on the pillow. Okay, so we're in kind of a half kneeling position here. You have the chair so you can maintain your stability if you need it. We're going to scoot forward so that we're nice and close to the chair, and we're going to step that front knee right along the side of the chair. I'm going to stand up as tall as I can. You can even use the chair a little bit to help you. And then we're letting our hips, you might have to move the chair out just a little bit. We're letting our weight shift forward to our front leg. You should feel a nice stretch in your hip flexor on the back leg. Okay? So we're leaning forward. This muscle helps to flex our knee up, so that back leg that's down on the pillow should be getting the stretch right now. When we do this stretch, we want to hold for at least 45 seconds. Now, I know that sounds like a long time, but studies have shown that quick stretches where we're bouncing in and out of the stretch aren't necessarily as effective as a prolonged stretch when it comes to improving flexibility and range of motion with Parkinson's disease. So keep that chest up, keep breathing tall, and hold for a good 45 seconds. You can repeat this 3 times and then go to the other side. So we'll switch knees, stay in our kneeling position, get the other leg up, and then we're going to shift forward with our chest up. Again, until you feel that stretch coming across the front of the hip. If you don't feel a stretch, then we need to modify things, or maybe just shift into the stretch a little bit farther, move the chair forward just a bit so you have more room to come into it. Okay? So this is a simple stretch that will really keep you out of that stooped posture that we tend to maintain, and will also giving you the long leg length, step lengths that we talk about when we talk about trying to increase the stride length with walking. Okay, so I hope you enjoyed this. We're going to give you more flexibility exercises and videos to come. If you like what you're seeing here and want to work out with us on a more regular basis, go ahead and click on the link in the screen, and we will see you next time on Daily Dose PD. Thank you.